Hi, this video is the art of hair transplant restoration surgery on a client who has a horseshoe hair loss pattern with a receding hairline and receding corner, and with a thinning around the frontal forelocks. So if you look carefully, you see how that pattern is doing all this. And then we not only lower the hairline, but we build the temple in as well, because otherwise his forehead is wide. If we just lower the hairline, because his temple at the both sides are receding a little bit corner. So we just put it like a finger breadth in. And when I do the surgery, it's very precise. I did all the measurement from the mid eyebrow to the hairline. On average for Caucasian and Asian, for Caucasians around 7.5 to 8.5 centimeter. For black and Asian is around 6.5 to 7. This client actually is 6.25. Although we use average height of ethnic hairline as a guide, but really when we build the hairline, we build it according to each individual facial structure to ensure that it's very natural and dense. So from here to here, 6.25, and as long as proportional to a third and a third and a third. And then from the midpoint to the temple, average around 7 to 8.5 centimeter. For this client, we actually brought it, his is up to 8.5 right now. We brought it in back to 7 centimeter because it's more proportional to his wall face. Right now his hair shape, the head is like a V because of the forehead the hairline is not only higher but it's further up. So we're gonna bring it in, so make it more perpendicular. And we'll be reinforced all around here, around the frontal forelock. And whatever we have left, then we reinforce the frontal forelock as well if there's space. But the main goal is lower the hairline, build the temple, and work around here. Hair transplant, again, as I mentioned, is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. Once we get the shape down, we would transplant at a very precise angle of 35-45 in the front. Increases when you go backward and changes when you go a different direction. For the temple, it's going to be flat against the skin, pointed down backward. The not only precise angle is important, selection of hair graft is important. We transplant rows and rows, single hair graft in the front, followed by regular 2 hair, 3 hair, and 4 hair in the back from bulk and volume. The temple, we transplant rows and rows, single hair mostly on the temple, because the temple doesn't really have a lot of thick roots, and anything beyond root 2 or root 3 or 4 hair, sometimes you can get away with root that go 2 hair, but it's got to be really far behind. But nothing beyond root that go 2 hair. This is the art of hair transplant restoration surgery on a client who has a receding hairline and corner with a frontal horseshoe hair loss pattern. Thank you.